My name is Dr. Harihara Murthy. I am a practicing ENT specialist living in Bangalore, and I have been in this profession for more than 30 years. Hearing loss is a very major concern for a person who has it because they cannot be having any social interaction because of the lack of hearing. So, helping the hearing to be improved is necessary in these situations. A hearing aid is a common use structure. So, a hearing aid can be put on a patient who is having some serviceable hearing, but in the case when there is severe sensorineural hearing loss, no response to any hearing aid, an implant may be required. Whatever may be the cause of the hearing loss, if there is a predominantly conductive type of hearing loss not really responding to any hearing aid, we do what is known as a bone anchored hearing aid. It's known as BAHA, wherein a device is implanted on the skull and that picks up the sounds and transmits through the bone into the nerves. As a result, it works in helping the person hear better. The common thing that most people hear today is the cochlear implant. That is done when children are born without a good serviceable hearing, as a result of which they have to be given a stimulant directly into the nerve. The interface that we spoke about is not functioning. The interface of the sound being converted to electrical energy is not happening, so the nerve has to be directly stimulated. So this is where the implant is placed by surgery into the inner ear. So you have the cochlea, which is like a conch. So the middle portion, which is called the modulus, this is stimulated by a spiraling array of the implant which goes into the inner ear, and it is stimulated from the outside by a processor. Now the processor processes the sound into electrical energy, and through the skin the device is stimulated and you have the nerve being stimulated. Now this is electrical sound which is stimulating the inner ear. This sound is computed in the brain like it would any normal sound, and then the person is able to hear. Now these children have to go through a process of habilitation to know and learn what sound is, because they have never heard sound before. Unlike us who have heard a particular sound, there is no memory of sound. So they have to be actually put through a process of training and development over many months and years, as a result of which they have very good speech. Many of them you will not be able to know that they were born without hearing, and they learned speech later on in their lives. They have such good levels of hearing and speech. So it depends entirely on the team that takes care of their training after the surgery, which makes all the difference to the quality of their hearing. So this is something that can be done for children. But then a cochlear implant is also used in the case of adults who have lost their hearing. Like, people keep aging, and with aging come many different neural problems. Loss of hearing is one of them. So in those situations, people who have lost hearing but they do have a memory of sound, these patients, because of the loss of hair cells in the inner ear, are losing their hearing. They can be benefited by giving them a hearing implant by way of a cochlear implant. This serves them very well. They hear very well, and they are able to keep their social interactions and interactions with people at home effective because of this. So a cochlear implant or a bone anchored hearing aid is something that is very useful for different applications, of course. There are some things known as sound bridges which are implanted in the middle ear onto the ossicles, and they augment the sound that is heard. So these are different types of devices which are used as implants in the ear for people who have different types of hearing loss.